Making the right decision about spine surgery. Everyone gets back and neck pain at some point in their life, just like you. Most pain gets better with time and a gradual return to normal activity. Over-the-counter medications, such as Tylenol or Aleve, can be very helpful for people with mild to moderate pain. Physical therapy is the most effective way to strengthen the spine and prevent further injury. There is good news. 99% of people with back and neck pain will get better without an operation. However, some back pain just doesn't get better right away. If you are seeing a doctor for advice and for treatment, it is very important that you educate yourself about your options so that you can make a good decision about your care. If you have had several months of continued pain, or if you have a neurological abnormality such as a weak arm or leg, then an MRI scan is often performed. MRI scans are amazing. They are literally like microscopes that allow doctors to look deep inside the human body and see all of its parts in fantastic detail. They clearly show the spinal cord, the nerve roots, and the intervertebral discs. Unfortunately, because the MRI scanner is so good at seeing inside the body, it will show every little detail of the normal aging process that causes your discs to narrow a little bit, bulge a little bit, and become a little bit arthritic. It takes an expert to determine if the abnormalities that are seen on your MRI scan are actually causing your pain. It is very important for you to realize that for 99% of people over the age of 30, an MRI scan of the spine will show a, quote, abnormal finding, such as a bulging disc. Many times, this finding may not be at all related to why you are having pain. If you have had an MRI scan, your doctor should go through the results of the scan with you in detail. You should be sure that you understand where the problem is coming from and why it is causing the pain that you are feeling. If you are considering surgery for neck or back pain, slow down. This is the time to make sure that you are making the right decision. This may be one of the most important decisions that you make in your lifetime. Spinal surgery is rarely an emergency. There may be other options that you need to know about. It is vitally important that you educate yourself about the different types of spine surgery, and especially if a fusion is necessary in your case. Fusion surgery uses special titanium screws and rods to stabilize the spine. This type of surgery is an excellent solution for certain conditions, such as something called a spondylolisthesis. However, for most herniated discs and other causes of spinal stenosis, a fusion may not be necessary. There may be other ways to remove the herniated disc and take the pressure off the nerve root. The medical literature shows that results of spinal fusion surgery for back pain, disc herniations, and spinal stenosis are not that great. In general, about 1/3 of all patients report that they are better after a fusion operation. 1/3 report that they are about the same, and 1/3 report that they are worse off after surgery. At the moment, there is no clear evidence that spinal fusion surgery is better than non-fusion surgery for most people. What should you do now? If you need help making the right decision, there are people who can help. Your family doctor may be able to help you sort out your options. It may be a good idea to get a second opinion from a different specialist. In Monterey, California, there is a team of neurosurgeons and orthopedic surgeons who specialize in non-fusion surgery. If you would like to talk to our patient care coordinator who will arrange to have your MRI scan reviewed by an expert, fill out this simple form and she will contact you. Remember, it's your spine. You need to make sure you are making a decision that is right for you.